name is Matt Rayner. I'm the publisher here at Healthcare Innovation, and I would like to thank you for watching this webinar, The Easy Button for Healthcare Engagement. This webinar will explore strategies for using AI chat to drive consumer-centric models for accessing the right care and patient services. A big thank you to our friends at Clearstep for partnering with us on this webinar. Today, you're going to get to hear from DuPage Medical Group's SVP of Patient Experience and Clinical Innovation, and from the CEO of Clearstep. Moderating this webinar is Mark Haglin, Editor-in-Chief of Healthcare Innovation, and this recording kicks off right as we are getting into the introductions. If after watching this webinar, you are interested in learning more about Clearstep, please visit clearstep.health to learn more. Enjoy.
I'm excited to be here. I've been looking forward to this conversation. I'm the Senior Vice President of Patient Experience and Clinical Innovation at DuPage Medical Group. We are now the largest independent provider group in the Midwest. And I came from United Healthcare, Best Buy, some other opportunities in the past to work on innovation. Excited to bring that same passion to my work here at DMG.
Wonderful. The first question I had planned to ask was to you, Joel, so I'm so glad we can hear you. Can you start by sharing an overview of DuPage's patient engagement strategy and how technology fits into the evolution of your strategy?
Yeah, so DuPage Medical Group has grown through, the partnership of many doctors over time. And so as we've gotten larger, we've had to bring together many different cultures, but all aligned around a singular purpose of just trying to deliver the best care possible for our patients. And so it really focuses on the interaction between our providers and their patients. And our technology strategies about enlivening and lengthening that relationship as much as possible as people need to navigate around care. So, you can imagine kind of the standard approach to many things. We want to have the best digital front door. We want to have the most seamless experience that connects to our EMR. But as we really try to navigate our patients throughout their care journeys, our strategy is evolving to make sure that we have all the various ways that a patient would want to communicate with us in their moment of need. And we understand that patients' communication preferences change depending on the acuity of their situation or what they're trying to deal with. So yes, it is an omni-channel approach, and it also has to be flexible so that if they're happy to chat with us or text with us in one moment, we know that in other moments they're going to want to jump on the phone and talk to us right away, or just be able to communicate with their provider directly in the office. And so our strategy has that type of flexibility to be accounted for.
Wonderful. Wonderful. Thank you. Adeel, tell us a little bit about how and why you and your co-founders came into the patient engagement space in healthcare, and what your approach is and how your solution works.
Sure. So I guess I'll give a little bit of a very brief founding story and why, and then the second part of your question, I can give some insight into how Clearstep works. But the founding story and why really kind of starts with how Bilal and I, my co-founder, started Clearstep, or even started our careers in healthcare, both in medical R&D, biomedical R&D, with a real passion for innovation in healthcare and wanting to drive change. Bilal and I actually knew each other from undergrad at the University of Maryland. Afterwards, he went on to do his MD PhD at Northwestern, and I went into healthcare consulting, doing strategy and analytics work at Accenture. And Bilal, via his program, was witness to a lot of clinical inefficiencies and care routing, people unsure of what their next step should be, his own network of family and friends leveraging him as a medical trainee to get care advice. And so he was really at the ground levels witnessing the inefficiencies and the uncertainty around getting the care and services that you need. And I, on the other hand, went into industry and was working with all sorts of healthcare players biotech, pharma, payers, providers, and interestingly, towards the end of my career, technology companies and retail companies that were trying to innovate in healthcare. And this was 3 or 4 years ago. So the concept of AI and digital, and IBM Watson was really big at the time, and AI diagnostics was starting to resonate with the market. And so Bilal and I kind of were putting our heads together to figure out really what we thought the unmet need was and where we can leverage technology to improve things like access to care and care navigation. And that ultimately led to the birth of Clearstep. And one of the really interesting things about our trajectory and our growth was a really important milestone for us was going through United Healthcare and Techstars accelerator program that was held in Minneapolis, the first cohort of which was the fall winter of 2019. And Joel, when he was at UHC as a VP of innovation, was actually the sponsor of that program, and was definitely responsible for bringing Clearstep into it. And now in his role at DuPage, it's been great to get to collaborate again and work together. But that's kind of some of the backstory, and to give you a sense of how Clearstep works, which is the second part of your question. So I mentioned the phrase smart care routing, and that we're a white label solution, meaning we will kind of match the brand and styling of our partners or customers, and also kind of configure the way we route people to their resources. And we bucket that capability into kind of 3 main categories: virtual triage, patient services support, and supporting patients' clinical journeys. But I can talk about the latter 2 later on and more kind of future direction stuff. Really, our core is in virtual triage. And what that means to us is, and what our technology is really good at, is on the one hand, really being able to understand well someone's clinical presentation, their complaints, and what they need for care from a clinical perspective. And then on the other hand, really understanding by way of integration the inventory of resources that our partners have, essentially. So, what docs, locations, facilities, services, et cetera, and sitting in the middle and better connecting those 2, right? So essentially playing matchmaker between what do you really need and what resources does, in this case, DuPage Medical Group have to offer. And so that's essentially the how the technology works. And I think, important things to call out is that there's pretty robust natural language processing, all connected to clinical medical vocabularies. The whole kind of clinical logic that we built everything on is in partnership or in working with Dr. Barton Schmidt and in partnership with Self-Care Decisions, Dr. Barton Schmidt being co-author of the Schmidt-Thompson protocols used in virtually all nurse call centers. So there's a high degree of clinical validity and intelligence to the underlying logic of how we're able to, and how accurately and robustly we're able to get someone from complaint to fulfillment, really, because that's the big driver in how we think about virtual triage. It's not so much directional care advice; it's driving to fulfillment, actually helping you get the care that you need. So yeah, that's a bit of an overview, and happy to dive deeper.
Wonderful. And that it segues beautifully into the next question I'd like to ask both of you. Many people have a very limited understanding of how AI can power or facilitate chat in situations like this. A lot of people imagine that it's very one-dimensional, gives yes or no answers, that kind of thing. Can you both explain how AI is powering this chat for DuPage Medical Group and what makes it robust? Maybe Joel, why don't you start first, and then Adeel, you can add on, if that's okay.
I think this time you're actually on mute, maybe from your own mic, or no? It's just putting Joel on mute.
Okay.
Oh, there we go.
That was actually my fault. Okay. I was going to say we should actually defer to Adeel. He's the AI expert for sure. I like to say what the tool needs to do, but he's the one that actually makes it real. So.
Okay, go ahead.
Sure. So I'm happy to kind of give insight into the actual kind of underlying technology. I do think, Joel, it would be great to kind of hear how you think about what AI needs to be able to do too, right? Even beyond what we're currently doing. So I think one of the we definitely want the audience to be able to take away practical strategies or ways to think about the space outside of just what Clearstep's delivering right now. But you're right, Mark, that a lot of people have this impression of AI chat being, or the concept of AI chat or chatbots being one-dimensional, as you said, or really simplistic. And the reason why people think that is because a lot of those experiences ring true of like using little customer service chatbots on websites that feel really kind of oversimplified and difficult to actually get what you need from. So you highlight a real issue, and I think the reality is we're trying to make that different with real intelligence and the way we're able to understand what someone's looking for and the way we're able to actually get them to that resource. So we take a lot of pride in the clinical intelligence that underpins Clearstep. I alluded to that natural language processing tool, really robust, trained over tens of thousands of data points, connected to ICD-10 clinical vocabularies, and then that algorithm or logic set that's able to say, okay, great, you're presented with a fever and a headache or a sore throat and a runny nose, whatever it might be, one of any couple hundred different chief complaints, and then knowing exactly what questions to ask you to start ruling out care options to then present you with what really is relevant. And we have an internal team of 12 clinicians, 6 EM docs and internal medicine doc that work with the original substrate of Dr. Schmidt's protocols and continue to kind of build on them and use them for our use case, which is consumer facing chat. But I think because of the experience people have had, it's really important to get the experience right. When someone does go onto DuPage Medical Group and use the chat, it has to be a powerful experience. It has to come through that this is intelligent, that this is useful, and that it's actually able to get you what you want. So I think that's one of the key things with like AI chat and actually driving engagement with it is actually delivering a powerful and robust experience, not something that feels super simplistic and kind of useless.
Yeah, and so I'm happy to kind of pick up from there of what that means for us. I think some of the most powerful algorithms that are happening are in the heads of our clinical staff and our frontline staff, because they understand healthcare probably better than anybody. And they go through, we have our processes and our workflows, but there's a lot of relationship management that needs to happen as much as the clinical triaging. And so for this AI strategy, it really helps our staff extend and even improve on what they're able to do and how much capacity they're able to take on. So I think about it as much as the value of relationship triage as it is clinical triage. Of course, having this tool to automate and allow people to come to us and start getting access to care as quickly as possible, the front end of that can really be improved with Clearstep. And we think of it as a funnel to get them to the right human conversation as fast as possible. So if that's getting through triage, getting to the right type of telehealth visit right away, or the right type of specialist schedule, we can schedule specialty visits right away, or even intensive care. I mean, that really it's about quick, easy access, but also personalized navigation and making sure that follows through into their interaction with the clinical staff or with the telehealth provider is really, that's where the AI has to perform, is making sure the context continues through to the in-person, even digital interaction.
I want to ask you both about two things that might not have been related, or one thing that was separate from another before 18 or 20 months ago, and that is the willingness of patients to engage on these platforms and what has happened since COVID hit our country and the world. Let me start with you, Joel, and then very much go to you, Adeel. How do you see the impact of COVID? We all know what happened. We had to move everything to virtual as much as possible last spring, and then some things came back to in-person. but consumers found they liked virtual care delivery and communication a lot. So how has patient engagement with platforms evolved forward in the last 21 months almost now? And how has, what have you and your colleagues learned about that phenomenon in the context of the pandemic?
Yeah, of course, we've learned some really interesting things, and we saw a massive spike in telehealth and digital care delivery, of course. What's been interesting is as we have come in and out of the pandemic and people have gotten used to, our patients have gotten used to using digital tools, doing face-to-face through their phone or their computer with their provider. And now having the option to come back into the clinic in many ways, we're seeing where the value shift is moving a little bit. For example, some of our primary care visits that would have been purely digital during the pandemic or the early stages of the pandemic are now patients are waiting and making sure they make the time to come in and get that face-to-face interpersonal reaction with their interaction with their doctor. And that's really interesting. Some of the other areas where they normally would have had to take time out of their day, they're not willing to anymore because they know that the digital interaction can be so easy. And it's really forced us to think through this kind of multi-channel approach where, many of the admin things or many of the interactions that can happen with just a quick conversation, our patients are expecting that and they're willing to use those digital tools. But there's some things that they've realized they truly value the in-person. They're also willing to wait. And so we're still learning. This is still balancing itself out, particularly across our specialties. Many of our specialties where even our providers have gotten used to the digital tools, and they will encourage their patients to use digital tools in certain interactions, even provider to provider, where we're building tools so that when you visit your primary care doctor, you can have a specialist on the screen right next to you. You don't need to drive all over town. You don't need to get off work twice. And we can navigate through some of those, getting labs or getting images done between visits. We can navigate those in a digital interaction, and patients are more willing to have those conversations with us as long as they're contextually relevant for their care journey. So it's interesting, the expectation of our patients has changed in a way that they are, they really want those digital solutions to be very seamless and very easy when they're ready for them. And they also want that in-person experience to be contextually connected and seamless and have it happen very quickly. Moving to paperless check-in, using, your app that has geo-fencing, so automation starts happening when you're getting close to the building and you don't have to have a piece of paper and check stuff off. I mean, all of those now those experiences are table stakes. Our patients experience them in other industries. QR code at the restaurant to get your menu. I mean, all that stuff is it's raised the bar. And so we have to deliver on those. But because it's healthcare, it's emotional, we also have to make sure that those experiences that added a lot of seamless automation are not, the ball isn't dropped when our provider is there, face to face, that all the information that was shared in those digital interactions is contextually served up to the provider, and then it follows through on the back end as well. And that's where a lot of the innovation is happening right now, is stringing all those experiences into one seamless journey. And that's exciting, and it's important for the industry to do that writ large.
I think that's very important. I'm going to ask you about that, Adele. I'll just make a statement as a consumer myself, both in the general consumer. I'm glad, Joel, you brought up the whole QR code, everyone learning to use their phone at the restaurant and get the menu. We're becoming more fluent in using technology in our daily lives, right? That we just have to. And early on in the pandemic, I had a couple of, I did have one, long story short, it had to be purely telephonic, but I was ready for a video visit. I was totally up for that. And I think that it's just going to become a very normal thing, and is becoming. Adeel, do you think that the pandemic has fundamentally changed consumers or their attitudes toward engagement with technology?
You know, I think it's a tough question. Like, there's data even before COVID around consumer willingness and desire to engage with healthcare digitally. There is, Rock Health produces every year consumer digital health adoption report, and they had a digital front door report that came out right before the pandemic too. And there are some interesting stats in there that 75 or 76% of healthcare consumers, patients, search online or search their symptoms online before actually committing to any sort of care, whether that's virtual or in person. And that was before the pandemic. Of course, with the pandemic, out of just no optionality, we saw huge surges of Clearstep use, huge surges of telemedicine use, all of that. But I'm not sure it was like a fundamental change more than a validation or a push in or an additional thrust in a direction that people already wanted to go on the consumer side. I do think on the provider side, on the provider organization side, it was maybe more arguably a kind of fundamental shift. People like Joel who are already living 5 years ahead and thinking about what experiences should be. I think we're also already there and trying to push towards that. But I think for the vast majority of systems, and of course everyone's been wanting to innovate, it just accelerated the adoption curve towards really being aggressive around promoting digital solutions and thinking about what the lasting impact of digital access to care is in many ways, right? Digital access to care, telemedicine, using something like a virtual triage tool or chat-based solutions or whatever it might be. So, I do think that there is a change, right? But whether that was a fundamental shift on the consumer side or just a kind of thrust in a direction that people already wanted to go, is where I think there's some questionability. But the reality is now we're here, and people are willing to engage more, and they see it more readily available because providers and payers pushed for making things more readily available. And so I think what's exciting is where we can now build, considering the additional push and thrust that the industry kind of got.
Mark, I think you hit on something that's really key, is that in a lot of ways we just onboarded patients into a new experience that they, in theory, were willing to do. We see this kind of across all industries. It has to be done the right way, but when people are onboarded and we hold their hands into a new experience that is going to be better for them, and they'll adopt it more readily. I think about our digital front door in that way, and also, which I would include some of our digital check-in experiences or checkout experiences at our clinic, and Clearstep is a big piece of this. In someone's moment of need, when they're really trying to find something quickly and they're going through the Clearstep experience, and we can get them to the right type of telehealth experience or chatting with a nurse or whatever it needs to be, we should also be thinking about that experience as a way to onboard them into a more digitally fluent experience with us across all of our brick and mortar, right? And so when I say it needs to contextually string together, this is all part of it. If we've onboarded them into these digital interactions, through a Clearstep experience online, it should feel just as seamless and easy when they walk into the clinic. And maybe even for walk-in traffic that didn't find us online, we should have a simple Clearstep type experience that can happen even in the brick and mortar setting, because it allows us to onboard them into other digital interactions later on, maybe in follow-up. So I think about a lot of these new tools as and what we're seeing with other patients as encouragement to compel us to say, let's onboard people, let's take these cues, let's hold their hand, let's help them, because it allows us to do a better job. It allows us to communicate with them in a more holistic way across their entire journey. And it's an opportunity that we have that really is kind of changing the face of almost everything that we do, even in the brick and mortar spaces.
Yeah. Yeah, I think what I'm going to do, I normally would not ask an audience question in the middle of our discussion. I would wait till the end. But there's a question that's come up from the audience that kind of speaks to what you just said, Joel. So I think I'll ask it and have you both respond. And the question is, how have you applied the digital engagement tools to enhance the staff/physician experience as they've been facing new levels of stress in the pandemic? I take that in two ways. One is literally how have you helped them, but also how have you helped them to understand why these tools are good and important?
I think it's a really important point. Our frontline staff, our physicians, it's a common thing to refer to them as heroes nowadays. It's fun to see billboards that even say that. I mean, they truly are. They have put in overtime and have done amazing things, carried a very heavy burden throughout this past year. And so one of the things that we've done to implement is we've sat down with them and we listen to them and we say, what needs to change? What are you seeing? What should just be a paper tool and what should not? Where do we update our systems and our technology? Our entire EMR strategy is being updated around the latest and greatest thinking from our entire care team. There's other aspects where we're even empowering our frontline staff, our reception, thinking about them as our patient-facing, one of our most important patient-facing experiences, and making sure they even have the tools so that regardless of who a patient talks to, walk in, frontline reception, or if they're talking to someone on the phone through our contact center, that all of those touch points have the relevant information needed for the patient so that the patient can ask questions, can get answers. Part of the frustration that we hear from our staff and physicians is that, our systems need to be flexible enough so that they can actually troubleshoot and problem solve for our patients. And that takes some configuration in the tools to make sure that everyone is able to do certain things within the EMR or update things within the CRM. So there's a lot of that type of tool-based stuff that is just getting up to speed with the latest thinking on interactions, but allowing our physicians to play at the top of their license and our clinical staff to
absolutely
to basically have that flexibility. And that's a big piece that they, as I said earlier, the algorithm that lives in their head is about as good as we're going to find in the industry. Giving them the tools that empower them to do what they know how to do is one of the biggest strategic moves we can make.
Absolutely. Adeel, how do you think about this in your mind, engaging clinicians and staff? I think it's amazing that you're in this healthcare space and as well as I do that healthcare is different in this sense. It's different from retail. It's different from Amazon. There are different sets of issues, and engaging clinicians especially so that they don't feel that it's just another thing they have to do or another issue that they have to tackle. How do you frame how you think about this?
For sure. So a lot of thoughts coming to mind. First, I thought it's worth just sharing our own personal experience. Every single one of our enterprise customers that we work with, we work pretty closely with clinical teams, chief clinical officers or leads in kind of clinical divisions. And I think it's very clear that DuPage has done a great job internally of being very physician-led. I think it's in the DNA of the organization. And we've had very close interactions with clinical teams to help shape the way that we route people, the resources that we actually offer. And so, I'll say more than most of our customers, really, we have really high engagement with DuPage physicians in just trying to get the most out of kind of care routing and getting people from clinical need to fulfillment. But your question, I think, goes beyond that. As much as possible, we try to not interfere with or affect clinical workflows at all. We don't want doctors to have to do anything different when having to interface or leverage Clearstep technology. We want it to just insert itself seamlessly into whatever existing workflows and kind of habits or the way that they currently work. And so there's a lot of ways, right now, a lot of our clinical interactions are just with clinical leadership, making sure we really get it right of getting someone from point A to point Z, considering that unique ecosystem of resources. But where this is kind of going and where we're leveraging virtual triage, hopefully with DuPage and with others, is to create clinical efficiencies in the kind of use cases that we're delivering. So, yes, right now we can help someone who's looking for care get to the right care. Maybe that prevents someone from picking up the phone and calling their doc unnecessarily. But we're trying to do more and more of that. So, getting the summary of a Clearstep clinical encounter as, an intake summary for the doc that they actually end up scheduling care with, so that they have as much context as possible, more of a 360 view on who the person is and the information that has already been collected from them, to make that encounter a bit more streamlined in getting to the meat of the issue and preventing people from having to repeat themselves. But then as we continue to build and move forward, I think part of the goal is to create such a kind of care navigation and routing experience that, like Joel said, enables providers to practice at the top of their license. So really the stuff that they don't need to focus on or spend a lot of time on, triage that away, allow, create patient value too, and just getting answers more quickly rather than necessarily having to wait for your provider to answer questions that are easily addressable either by someone else or just automatically. And then, by doing so, creating more time for providers to have like richer encounters with the patients that really need their time and attention. And it's kind of an extension of the same premise, right? Smart care routing, just getting people to the right care at the right time, making sure that the providers are seeing the right patients at the right time, and kind of helping prioritize that queue so that time is spent efficiently. And the last thing I'll say is, like, because so much of our organization is our clinicians, our clinical team is the biggest subgroup of various Clearstep teams. We really take it seriously to address kind of clinical concerns, clinical perspectives. All the docs that work with Clearstep do practice, as well. And so they kind of bring the clinical perspective to their work at Clearstep every day, which is, we like to think it's also ingrained in our DNA, the kind of clinician perspective. And yeah.
Absolutely.
I will say there's one thing specific in there that Adeel talks about that we can't do enough of, and that's just automate away a lot of the admin stuff that we know can be easy buttons, as the title of the conversation says. So much of our call volume is around prescription refill and scheduling a referral and helping me understand a bill, things like that. That some of that is complex. Some of it we can shave off easily, and more digital tools like what Clearstep can help us build is going to be key to that. Is just removing a lot of the admin and the burden around some of these paper-based things that we know we can with better tools make easier for everyone.
Joel, what do you think? I'm moving towards summarization and where we go from here. What will be the biggest, I'll ask you both this, what will be the biggest challenges and opportunities in the next few years for you? First, for you and your colleagues at DuPage Medical Group, and then I'll ask Adeel about the national landscape.
I think for us, some of the biggest complexity is just around navigation, tying together, because we are multi-specialty and we have a large primary care front end, is trying to help people navigate through. And that's pulling together a lot of complexity across our specialists, our primary care docs, and making sure that we can, help navigate people. I think the digital tools that we've looked at are all really encouraging, and they all can get us there. But what makes healthcare a little bit different is there's a lot of complexity in managing people's care while also making it really easy to access. And so I would say that that's a challenge. We can just in theory open up and make scheduling open, and people it can be like booking a plane ticket, and that sounds great. But, we don't just want to let people drop drop an appointment on a specialist calendar if that's not the right place, or that actually wouldn't get them further along in their care journey. So navigating all that complexity is going to be a challenge, while still meeting our patients' expectation as consumers that these digital tools need to be super seamless and fast. And so part of what Adeel's talking about that makes us special is when we say we're physician-led, we have partnerships with all of our care delivery partners in the area, and that allows us to have really great flexibility, and our physicians can determine the type of care that's appropriate for our patients, and patients seek us out for that. That also requires us to be really, deliberate and specific in how we build tools and automation and access and navigation for that. So there's innovation required around even the staffing models and how we define our roles. There's innovation around the brick and mortar footprint and what we're really using those precious resources for, if we can push some of the volume to digital spaces. So there's a lot of retooling of the system that is going to happen over the next several years.
Makes sense. Adeel?
Sure. So, and just to clarify, your question is basically like, what is the future entail?
What are the challenges and opportunities? Yeah.
Sure. So I think there's two buckets here. There's features and functionality, like where the product goes. And then the second bucket is largely around engagement and driving engagement, and that being both a challenge and an opportunity. For the first point on just like product and features, I alluded to it earlier on in the conversation that, Clearstep's all about smart care routing, and there are three buckets to how we think about that. And the first is really virtual triage, and that's really what we've built the foundation of the company around, and that's where most of the conversation has been focused. But we've started to really expand the product beyond just the concept of someone who's symptomatic with a clinical presentation and fulfilling the demand for that care into a broader concept, which is how do we take someone, a healthcare consumer, a patient who has a service need that comes to DuPage online, and deliver an intelligent routing experience that actually gets them to what they need for the widest variety of needs as possible. And so that's where those two other buckets that I referenced earlier on, patient services, support or chat workflows, and clinical journey support chat workflows kind of come into the picture. So doing things like helping someone who just needs to refill their med, or understand what's in network at the provider system, or just quickly find a doc, or quickly understand what the next immediate availability is at an express care clinic. Or the way we kind of think about it is, what are the most common reasons people call a call center, or try to reach out to the system, or the most frequently visited web pages online, and how do we make it easier to get from I have a need to driving fulfillment, right? An easy button, as Joel has been calling it, for whatever that need is. And that's kind of patient service. The clinical journey stuff is around, how do we take someone who's not necessarily symptomatic, but they have a condition that's maybe more chronic, or they were recently diagnosed with something and they know they're going to need a bunch of touch points for care, or they're going to need some follow-up kind of logic. And how do we automate the kind of information and interaction with that person, just get them the content, information, next appointment, whatever it might be, as quickly and seamlessly as possible. So, but the basic premise is really broadening smart care routing to be able to satisfy the widest variety of needs for a healthcare consumer. That's the product and feature kind of side of things. Go ahead. Yeah.
Sure, I thought you were done.
No, so the second area was around engagement, right? Which I think is a big thing. Like, even though we've seen spikes in engagement, even though there is kind of a shift that we've seen over the last 18 months, there still is this big challenge of how do we get more and more people to engage digitally, to be comfortable engaging digitally. And I think there are three things three components to that as well. The first is just driving utilization. Like, how do you get someone to go use it one time, right? And that's where working really closely with marketing teams, patient engagement teams, digital teams on product placement and CTAs and how it lives in a mobile app or how it lives in the online ecosystem, and being really intelligent about making sure that the product is promoted, that kind of comes into play there, just driving initial utilization, getting someone to go use it the first time. Then the second piece is around, okay, they used it that first time. How do you capitalize on that opportunity where you have someone engaged and create value out of that experience, both for the patient and for the organization? And that's where we're going back to earlier discussions of making sure you're actually delivering a powerful, intelligent, connected, personalized experience that doesn't feel overly simplistic or something that you go through and you're like, all right, next time I'm not going to even use that thing. Right, I'm just going to go back to an analog method. So delivering a really rich, powerful experience is super important to make sure you're driving engagement. And then the third thing is around around bringing people back. Right, they used it one time. Did you deliver enough value in that experience that someone's going to remember to come back and use this again and again? And I think the main thing we think about for that third piece is how integrated is that experience, right? Some partners we have very light integrations where it's just simple buttons or web links, and with others, DuPage being a primary, we're pretty deeply integrated into scheduling systems and provider data, and so we're able to create value in that experience of actually not just saying this is the kind of care you need, here's what's available near you, differ that care whether you're a new or existing patient, but we're able to get appointments booked and allow people to be seen after just going through, a minute and a half, 2-minute process. And it's really easy. So that really helps to both create value in the experience, the second point, and the third point, to bring people back to it. So I know that was a lot, but there's a lot in the future coming, and there's a lot of opportunity and potential. So hopefully that's useful for folks to hear.
No, I appreciate it. Very rich commentary. Thank you, Adele. I think I'd like to close out by just asking you both to give us advice for those who would follow in your footsteps. Why don't you start, Joel, and then I'll have you respond also, Adele. Just advice to people who might choose to replicate what you've done.
I think as Adeel was talking, it rang true in my head of this when we talk about these new digital tools, what they really are, these easy buttons are really just they're meant to enhance the human relationships that are built within healthcare. And so if it's shiny technology looking for a problem to solve, it's probably going to fall flat. If it instead is in service of the conversation that's going to happen between the humans eventually, then that is going to set it up for success. And that is everything that we do is kind of focused on making sure that that's a reality. And we hear this from our patients that they get really frustrated when it feels like they're asked the same question 3 or 4 times and they go talk to their provider and their provider asks again. And they're like, I just answered that survey, or we were chatting about this online with the computer, and how come you don't know? I've already sent in a picture of something. So that is a real challenge, is to make sure that these digital tools aren't just a way to sweep things under the rug, that it really is a way to build on the relationship and offer true navigation. And that's a real challenge. And, so integration, as Adeel's saying, is really important. But, integration for the sake of integration isn't going to be good enough. It really has to empower our clinical, our physicians, and even our frontline staff. And that's the real test, and something that I think we all should strive to continually improve upon.
Totally makes sense. Thank you so much. Adeel, your thoughts on that?
Yeah, sure. I think I really like the way Joel puts things, of making sure the technology is positioned in a way that just serves to enhance the actual person-to-person interaction. But when it comes specifically to the technology, I think I can provide a bit of a lens there. For things that are clinical in nature, clinical care routing, triage, I think by far the best advice that I would give is to really, really make sure that the product that you're delivering is clinically robust and accurate. People get really frustrated when it's just clear that something is either too simple or incorrect or super like has too much breadth, right, in terms of the ways that it might, like, it doesn't seem like it's intelligent enough. So making sure that there is a really strong clinical foundation for anything that is clinical in nature for technology. But then I think three other things that come to mind. A really strong user experience that makes someone feel like they're not necessarily in a healthcare user experience, right? That resembles user experiences from other industries. So really big focus on like what actually does the user experience feel like for going through any kind of technology. Third, so have it be deeply integrated as possible, so that it's personalized. There's scheduling integrations, there's provider. Like I said, it's not just directional advice or information or whatever it might be, but it's kind of plugged into the rest of the ecosystem. And then fourth, for any kind of digital technology, a real dedication to actually driving success utilization of the technology is really important, right? Like, you can go stand up any kind of digital technology and kind of tuck it away in the corner, back corner of a website or somewhere else, even in a patient portal, and it's just not very used, and people aren't even aware of it. And you can't get value out of any of these digital technologies without people using it, obviously. So there needs to be a pretty deep organizational commitment to driving utilization of new technologies. That's not just Clearstep. That's really anything that's innovative. And again, I think Joel, coming from an innovation background at Best Buy and at UHC, like, that was the big thing. Like, going through the TechStars program too, it was that was the whole point of the whole UHC innovation sponsorship for what we were doing, is like trying to drive forward this idea. Not just at United Healthcare, but broadly, the program had a lot of different kinds of mentors from different healthcare organizations. This idea of really leaning into innovations that are occurring, and I think those are kind of the four things that I would highlight.
Wonderful. In other words, we have to create intelligent artificial intelligence. We have to put intelligence into our artificial intelligence, and we have to use it intelligently, right?
Yeah, definitely.
Yeah.
That's a good summary.
So, thank you. Well, I will just add this. I think that this is such an exciting area that you're both involved in. The potential is almost limitless for this to really improve healthcare delivery, improve the patient experience, and also improve the clinician experience, so that we're pulling some things away from physicians, and in some cases even nurses. They're so burdened right now. They really need help. And they also want to provide their patients with a good experience, but we can't put everything on them. So I think it's a wonderful opportunity to create less friction. People talk about frictionless, the frictionless healthcare consumer experience. I don't know if it'll ever be completely frictionless, but we can get close, right? And this is a wonderful opportunity for patient care organizations like DuPage Medical Group to really leap in there, make some real advances, and begin to optimize the patient experience. So I want to wish you all the best at Clearstep. I think you're on a really, really smart path here with what you're doing. And of course, at DuPage Medical Group as well. I know you're a very, very innovative patient care organization. So that's basically it. I want to thank you both. We're at the end of our time. I apologize to our audience for our little technical difficulties at the beginning, but we got over those, and we were all able to spend a good deal of time in really meaningful discussion here. So Adeel and Joel, I want to thank you both so very much.
Thank you, Mark.
Yeah, thanks so much, Mark. Appreciate you having us. Thanks, Joel.
Absolutely.
Thanks, everyone.
Yeah, it was my pleasure.
Yeah, appreciate it.
This concludes today's program. I want to thank everyone in our audience for being with us, and we look forward to seeing you in another healthcare innovation webinar. thank you all very much. This concludes today's program, and have a great day.
Thanks.